I want to thank Leanne, Stacy, and Lamar for inviting me, first of all, and a little special thanks to my friend Laura Sundberg over here as well. So I'm glad to be with you tonight and glad to present for the Central Florida State Planning Council on this topic, on the, you saw it about behavioral health. I call it breaking the cycle of crisis, because it's the thing that most impacts folks who are in your roles and the families that are serving or working with the person who's the beneficiary. They are in crisis all the time. It's very disruptive to family and relationships and can be heartbreaking for a lot of people who are involved. So I'm Todd Weatherly. That's me. I know things. I've been in the field for a little while. I have a private consulting business, or a therapeutic consulting business, or practice, we call it. Stucker Smith and Weatherly. We're a team of 5 consultants who work with families that are struggling with mental health and substance use conditions. Mental health conditions go co-occurring with substance use conditions. If you have a substance use condition, you probably have a mental health condition. That's just kind of how that works. So, and that's kind of what we're going to talk about a little bit. But I've been in the field for 30 years. I've been in the private pay side, and to explain what that means, most of you know what a hospital is and what community mental health is, right? And you may have seen people go to their outpatient practice, and you may have seen people even receive, anybody know what an ACT team is? Okay, so an ACT team is a team that runs out for people who need specialized services, and they go, help them get their meds and do all the things that they need. Those are all community mental health. They can be very useful, but largely they're ineffective at the level of need that these folks have. And so you end up in the private pay side, which is if you got enough money, you can pay for your care. The truth is that we do pretty good with mental health care, actually. So let's talk about that a little bit. This is a former client of mine who had schizophrenia, and this is his drawing of what that felt like. So, what's the problem? Why do we have so much trouble? Especially after the pandemic, everybody knows that there was a lot of people who suffered pretty greatly, including children in schools, as a result of the isolation, an increase in symptoms, and then they go back into the world and it's like, it's too much for them to handle. What's the problem that we're really facing? Other than we could go down the rabbit hole of what causes mental illness, we can go down the rabbit hole of the ways in which people end up with a condition. Sometimes it's genetic, sometimes it's related to trauma. There are all kinds of reasons, cognitive and otherwise. But mostly what you've got is people don't get the right care in the end. So by the end of this presentation, what I want you to do is kind of have an understanding as to why crisis occurs for folks, and then how it gets handled and that sort of thing. But most importantly, I want you to have a structure how to end that cycle, because there's a structure to it. There is just like most of you, if you have a client and they need financial planning resources, or they need an accountant, or they need a CPA, you give them tools, and it's like, I need you to organize these things, and this is the process that we're going to go through, and this is going to take time, and these are the things I want you to do. Mental health is no different. It really isn't. So hopefully you'll have, by the end of this presentation, a basic outline for what that means. So this was fun. I went to the internet and decided, okay, I'm going to type in conditions and see what images it produces for me as a representation. I used to put a lot of words up here that are hard to read because there's so many of them, but this is, when things fall apart. People isolate, they're overstimulated by their environment, they fall into depression, they get arrested, they get hospitalized, they have a psychotic break, they relapse. They go off of their meds, or they get the wrong meds, or they have too many meds. They don't know that becomes a problem that replicates itself over time. Medications can be very complicated when you have complex conditions. So I just dropped in to see what condition my condition was in. Again, I let the internet kind of pick away at what kind of images it would give to people. What is this one? Does anybody know? Very good, very good. Nice narcissistic personality disorder, exactly. How about this one?
OCD.
OCD, well, hand washing is kind of a classic symptom. We'd hate to boil OCD down to just the people who obsessively wash their hands. It's much more complex than that, and it can be a terrible condition to suffer from. So, how about this one? Autism spectrum, well done. Got a sharp crowd here. So, and then, you got vets who suffer from PTSD, and you've got individuals who are in recovery, but they relapse. You've got, how about this one? ADHD, that's the image you gave us. And then you've got all kinds of conditions that come with psychosis, psychotic disorders, or a disorder with psychotic features, right? So this is just a grab sample of conditions that you can find a diagnostic profile for in what we call the DSM. Anybody know what the DSM is? Even if you don't know what it stands for, you've seen the book, Diagnostic to Statistical Manual for Mental and Emotional Disorders. It's about, I don't know, it's like that thick. And it's the coding mechanism for emotional or mental and emotional disorders. It allows people to say, okay, this person has this disorder, these are clinically significant, I can tell the insurance company, and theoretically they'll cover it, they probably won't. And at least we know what their condition is, and there's a code for it, right? We know what your condition is coded as, and theoretically, we also know what treatment is prescribed for it, theoretically. So that's the first problem. First problem is properly diagnosing a condition. Anybody have a family member, or anybody ever have another person who's gone to the hospital, they threw a diagnosis at them, everybody knew it was wrong, or they saddled them with a bunch of meds that are there to treat bipolar disorder or some other disorder, 3 antipsychotics and an antidepressant and some Zoloft or whatever it is that helps with depression. They walk out on 5 meds. You've seen this before, probably. Some of you have, I'm certain. Because when you go into the hospital, unfortunately, the hospital is not a very good environment for actually diagnosing a condition. Usually people are in crisis, and trying to evaluate a person in crisis is not a great way to get good results. If you're screaming at the top of your lungs, I know that you're upset, I don't know why. And I'm probably not going to get very good answers, self-report being what it is, about what it is that's really going on for you if you're in the middle of a hospital, in the middle of a crisis. So trying to diagnose people appropriately is a problem. Happens all the time. That's number one. Number two, because hospital's not treatment, they may dope you up enough to put you on the street and call you safe. Criterion's you're not a danger to yourself or anybody else. You're ready to go. Problem solved. You also have the kind of treatment that goes with the kind of condition. So if you misdiagnose a condition, then obviously you're going to probably misprescribe the treatment. These are this is a grab sample again of treatment modalities. Anybody ever done DBT therapy? No? So a lot used for people who suffer from a lot of anxiety, maybe they suffer from trauma, maybe they suffer from depression. DBT is used a lot as strategies for keeping you calm when you feel like you're not calm. TBT is a form of CBT, cognitive behavioral therapy, motivational interviewing. MAT, anybody know what this is? So medication-assisted treatment. Now, theoretically, medication-assisted treatment is like you give them meds, right? No, that's actually for a person who suffers from opiate addiction. MAT is when you give them Suboxone or methadone or something like that. It's an opiate, but it doesn't get you high. And you'll find a lot of vets on that treatment because they have chronic pain. So it's something that goes to treat chronic pain, but in addition to that, they're also suffering from PTSD and depression and a lot of anxiety and other things, and it's still not enough. The thing that they were using opiates for, and the reason why most people seek out drugs is because, sure, there's the partiers, but by and large, it's for what? That's right, symptom abatement. People are self-medicating. They're doing it all the time. Family therapy, what's this one? Does anybody know? Equine therapy, right? What's the therapy of all these on the screen that is used more than any other? Which one? Drugs. That's right. You got it. Drugs. Why do we just use drugs for Medicaid for treating people with these conditions? Because we're lazy. I mean, sure. Here, I want you to spend a lot of time intensely talking about all your deepest, darkest problems. Do I have anybody to sign on? Would you like to? Right? It takes a lot of courage to do that kind of work, which is why we use medications, because I don't know where you're going to go. You're going to go out of the hospital, you're going to go out of the care provider's office, and that person's going to be like, well, I don't know if you're going to do therapy. I don't know if you're going to get treatment. I don't know what you're going to do. So I'm going to give you enough meds to help with the symptoms. I hope that works. Problem solved, right? Okay, so these are our two major issues. Identifying the right care, or excuse me, identifying the right condition, and then finding the right treatment. But that's still not the whole equation. You have to align the two, right? We want those two to match. We want the condition to be properly diagnosed, and we want that condition to line up with the kind of treatment that we're going to give you. If you walk in and, if you walk into a hospital or walk into your doctor and they think you've got one condition, but you've actually got another, and you start down the road of getting the wrong treatment, in the medical world, that doesn't typically go very well, and that's what doctors get sued for, right? They don't get sued as often in mental health because it's tricky. It's pretty tricky. So not only do you have to have a good way to diagnose the condition and the right treatment for it, but you got to do it for long enough and at the right level. So there are levels of care and there are durations for levels of care. Anybody know anyone who's gone, they had an addictions issue and they just went away for 30 days and they came back? How many people who knew this person or persons found that strategy to work? I see a lot of like these, like, no, it didn't work. And that's primarily because, first of all, when you come out with a condition, part of getting the right care is also the right level of care. So let's say you do suffer from an addictions problem and you've been drinking, it's gotten out of hand, and you've even been to the hospital because you've had alcohol poisoning and it keeps happening. You guys have beneficiaries and clients that have family members like this, right? And that's not the only thing. They also blow through all their money and they destroy things like cars and houses and everything else, and they ruin their relationships, and there's a lot of estrangement between family members. It destroys a lot of their lives. So they go and it's like, I'll be fine with some outpatient care. No, you won't. Most hospitals will refer you to an outpatient system because that's all they have and that's all they know. The truth is that you've got a variety of levels of care. You've got hospitalization here, right? You've got an assessment and stabilization center that's down from hospitalization. Usually those don't last very long, but they keep you long enough to actually get a good look at what the problem is, stabilize you so that you're ready to go to residential treatment. Some people don't need to take that step. You can go from the hospital to residential treatment. Residential treatment's anywhere from 30 to 90 days long. You go from there, you go to partial hospitalization. That's like 8 weeks. Intensive outpatient, also like 8 weeks. Each one of these levels costs a little different. Some of them come with supported housing features. If you're a person who suffers from a severe addictions issue, say for example, and you get through the end of this cycle, how long should you stay in sober living? What do you think? Give me a guess. A year, I like that answer. I'd say at least 6 months, but I like year better. If you've been hospitalized for a psychiatric condition or an addictions issue, the chances are incredibly good you're staring at 1 year to 18 months worth of care at various levels. Each one of those levels has an appropriate length of stay, and if you don't, just like if you go into the doc with a medical condition, if you don't follow the treatment protocol, the likelihood of it resurfacing is pretty high. So, continuity of care. You also have to make sure that in between these levels, everything lines up, because not everybody does all the levels of care. You might go to residential over here, you might go to PHP over here, you might go to IOP over here and go back home for sober, like you've got all these places where these different things are happening. So there's your framework. That's the framework for how a person can move through severe and persistent mental illness and or addictions issues through a treatment protocol. That is what it takes. Most people don't want to do it. At the top of one of these, I'm sick and I don't need help, is a book. And there's a few YouTubes about it, but there's a book that's written, I'm not sick, I don't need help. And it's because people are really, especially the sicker you get, the more unwilling you are to admit that you are sick, and the more unwilling you are to actually go get the help that you need. So, I like to do some case examples because this is always fun for estate planners and finance folks and everybody else. This young man is the beneficiary of several trusts, actually, that attorneys are trying to work so that all the trusts can be consolidated into one and can get cleaned up and everything else, but it's a mess. But there are millions and millions of dollars. So this angry young man, 27 years old, he's due to get millions of dollars. So before they started down the road of working with us, getting him under guardianship, putting money in pockets so that they couldn't all be accessed, restricting his access to funds, etc. He had access to funds and he decided he was going to buy him a house, and that was going to be an income generator for him. There's the house. Wow. That's what I said. So he just left the house. There's also 2 cars in the car garage that he bought and he can't drive anymore because he went and got a DUI and he's not allowed to drive. A leak formed in the house and he just never went back. So now this belongs to the trust. They can't sell it because no one will take it. And they're probably either going to have to tear it down and just sell the land. They're talking about donating it, but it's a giant pain in the butt for the estate planner and the attorneys and everybody else that's involved with the trust management. This young man also, father passed, a lot of money was left behind. Mother is estranged from his family, his aunt and his brother, who are the other trust protectors. They have a say about the money, but they don't control it. He tries to get with his mom. His mom tries to get him to get money to give her money because she's also under guardianship. It's messy. It's really messy. So we were able, specifically this young man, he had a DUI, he had several offenses and charges that he was up north, and he was telling his attorney that he was basically the court wasn't going to find him guilty. They were not going to do anything to him. He was going to just kind of get off scot-free, and the attorney didn't know what he was talking about. So he maintained that for about a year. And the attorney just kept continuing it. And the woman that I have working with him is a clinical psychologist who's on our team, finally got him to agree. So he got to, instead of going to prison for like a couple of years, he got to do a short stint where he goes to prison a couple of days a week, comes back, and can still maintain some aspect of his life. But it took us a year and a half to convince him that he needed to take the deal. So anybody got a beneficiary like this? Or somebody in their client pool that's like this? Yeah, okay. So, kind of part of what we do is we stand there and we manage the drama of it. And then, whenever an agreement needs to be signed or a trust, just getting the keys to the house. It was like passing an act of Congress to get this kid just to give up the keys to that house so they could take control of it. It was really something. Borderline personality disorder. That one's fun. This woman was 60 years old. She was a pro. And what she really liked to spend her money on was expensive treatment. So this is a treatment facility in the Carolinas. It's $28,000 a month. Now for treatment, that's cheap. That's cheap. For private pay treatment, that's pretty cheap, actually. Sometimes you can get insurance to pay for it. A lot of times you don't. So, but there are plenty of, I'm sure that many of you here are working with a client or a client family that is a family of significant wealth, and paying for this kind of treatment doesn't mean anything. But this, there were 3 siblings. It wasn't an inexhaustible amount of wealth, and she started burning through it at record pace. They had to finally divide the trust up, or the funds up, into 3 separate trusts, and say, wouldn't talk to her mom, estranged from all her sisters, doesn't talk to family anymore. There was a trust protector who had been involved, but she decided he wasn't worth anything, and she wasn't going to talk to him either. They got us involved, and we had to become the conduit for communication for getting all this done. Finally, gave her a pot of money, said, this is your pot of money. That's it. Don't spend it all in one place. So in order for her not to spend it all in one place, they let us handle managing her around the spending her money. In the end, we were able to get her to the age of 65. She was 61. We were able to get her to the age of 65 with $100,000 left in her account so that her benefits took over and she didn't go homeless and didn't get left. She lives in California. She's doing really great. But man, I tell you, there were 2 years where I didn't know. I didn't know if we were going to end up in a good spot at all. They're not all great stories. They're not all happy endings, as you all know. Case after case. I really liked Lamar's presentation where he talks about, like, hey, we've got all these people and we want to be partners and we want to collaborate and we want to, we know that you do this part and we do this part. Let's make sure that we can work together so that everybody's parts come together. And I also know that there's members of the finance industry here, CPAs and otherwise, and anybody knows the bank that turned down a client regardless of the amount of money because they had this kind of situation going on? Yeah. Oh yeah, you hear about it all the time. Well, they don't have resources like us. Navigating that whole system that we talked about in the beginning, people get incarcerated. Maybe it's not mental health, it's dementia, which is hard, which if you try to send somebody they're having what looks like or sounds like hallucinations, they're having suicidal ideation, right? And then you send them to the hospital and they try to dope them up on psychiatric meds, antipsychotics and all kinds of stuff. And then for some reason no one catches it, but the person actually suffers from dementia. None of those meds work on dementia. You've just given this person a buttload of meds, none of which is working for them, probably makes their condition worse. What you're going to need is memory care and find a home that will support this person in their living and doesn't get immediately scared away by the fact that they've had suicide attempts or that somebody looked at them and thought they had a psychiatric illness. Because finding a supported living home for somebody who suffers from what they refer to often as just, they're psychiatric, they're aged and psychiatric. They get turned down all the time. It's really hard to find some place where that person can be. I had to free Brittany, of course. I just went to I went and did a presentation for the National Plan Alliance up in Kansas City, and there was an entire presentation on the Free Brittany thing. And it does look like her family was using her mental health condition to keep her in the hospital and have access to her funds. So it can go the other way too. They didn't have anybody like us or any other kind of consultant. They needed people to co-opt. They're thefting all of her money. I mean, all of her millions. Dad was getting a salary for doing this. Anyway, it was an interesting case. Oh, hold on. Sometimes hit the wrong button. Oh yeah, there we go. Yeah, we came back. We're back. All right. Okay. So what is a therapeutic consultant? Excuse me. Well, I don't know what it is. Basically, for some reason, and I can't tell you why, none of the chaos bothers us. I've been in the field 30 years. I think I took 1 year's worth of break. I work with other people who are we've got CPAs in the room. You want to talk about something that would lead me to mental illness, it's trying to... It would be having to do my own finances and not having a CPA do mine for me. So, we work with people who are in utter chaos. We help them navigate the mental health system. We help them find the right treatment, because even if you have the money to pay for it, doesn't mean that it's going to go right. Doesn't mean that you can't make mistakes. Doesn't mean that there's not a bad actor out there who'll be like, oh yeah, we can treat your condition. But they can't. They don't know what they're doing. The person ends up worse off than when they started. So if you're going to pay that kind of money, if you're going to navigate this whole system at all, you want it to work. You want to take the right steps. And you want to know, if you're a mom or a dad, kids don't listen to their parents, right? I mean, if you've got somebody else who can say, I can say the same thing to some clients that their parents said to them 1,000 times, but they listened to me and didn't listen to mom and dad. I mean, that's fair. It's the same with my kids. But we are here, and what we do is we help navigate, all the challenges that are associated with getting in and out of programs, where to go, how long to stay, et cetera, et cetera. That's something a therapeutic consultant do. But you also have you have therapists, and you have doctors, and you have other folks. There need to be someone who knows the entire system, though. Because the problem that we run into all the time is that we run into professionals all the time, but they don't cross the system. They don't know about the other levels of care. They never leave their office. They don't know that there's a residential program 20 minutes from this location for primary mental health, 40-bed psychiatric treatment program for people suffering from severe and persistent mental health conditions, right here in Orlando. There's 3 of them, actually. But the doc in the hospital across the way doesn't know that. Why that is, I don't know. I guess they just don't get out enough. But so being able to navigate you have to travel. This is me going around. By the way, when we travel, we do play a little golf. This is a treatment program in Alaska. This is one in Oregon where you got to go ice fishing. This is one in Utah. This is one in the coast. This is one in Arizona. There are thousands of treatment programs across the country. I visit 60 to 70 a year. And I've been doing that for a decade. And I still run into programs I've never heard of or seen before. And I run into new treatment models in places that are going, hey, this is the most innovative thing. Anybody heard of what they call rapid TMS? Rapid TMS, anybody what TMS is? Yeah. Okay, transcranial magnetic stimulation. So basically, you get exposed to transcranial magnetic stimulation for a period of time. It's incredible for depression. It's incredible for PTSD, for trauma treatment. Rapid TMS is 10 sessions a day, 10 minutes every hour. And they're seeing results the research is coming out, and it's a non-medication way to treat severe and persistent mental health conditions. You wouldn't know that because you can't read about it, because you need somebody who's wandering around the world to figure out where the coolest things are happening and whether or not they work. So, we develop plans, we assess what's necessary, we work with you, attorneys, trust officers, CPAs, we work with everybody that needs a slice of this pie to make sure that the crisis isn't happening. Because what happens is, most of you experience from the finance end to the planning end, and we tell clients all the time, do you have a financial plan for your child? Do you have a trust set? Do you have a special needs trust set up? Do you have a financial planner? Do you have a trust attorney? Do you have somebody who can write up the language appropriately for you and give the trust the language it needs to restrict and withhold funds at times when a person is in crisis? Because they can blow through some money when they're in crisis. I promise you they can. And they can do some really destructive things. So we send folks to you folks all the time. It's like, we'll feed in our part, but you need an attorney. You need a financial planner. You need a guardian. You want to know where to go, what to do. You want to keep the basics in mind. Even if you don't have a consultant involved, what condition are we dealing with? It's the best way to treat it. You might know. I mean, it might be as simple as like, this person's obviously suffering from severe depression. They need somebody who specializes in depression, and they need an intensive approach. What level of care do they need? In Orlando, you've got all those resources within a 20-mile radius. What level of care do they need? How long will they need to stay? How much support do they need coming out? What kind of budget are we working with? Maybe you've got an individual who has a special needs trust, but it's only got $500,000 in it, and they're 24. It's not a lot of money to last for the rest of your life. So you got to be careful. Who needs to know? Who needs to be involved? Who's the care team? Those are the things that you want to keep in mind and ask those questions. And if you can't answer the questions for yourself, find someone that you feel like can. And I wanted to leave enough time for you guys to ask questions, and because we could go down lots of rabbit holes here, but I want you to be able to choose the rabbit hole that we go down. Yes, sir?
You mentioned on your timeline partial hospitalization. What is that?
Okay, so partial hospitalization, about half of them will, the difference, it depends on where in the country, but in Florida, and most of the places in the country, the difference between residential care and all the others down from it is that you provide care, therapy where you live. Residential license allows you to do therapy in the place where the person resides. When you step away from that, PHP, you live over here and you go over here for care, which is why PHP and IOP can be levels of care that exist in a community, and people are coming from their homes to receive that treatment. There are times when even people with urgent or chronic conditions or acute conditions, because they know they need help and they want it, they might benefit from a PHP program, and they don't have to go to residential care. Sometimes that might work, you just want to be able to evaluate it. But by and large, it means that it's an outpatient. Partial hospitalization means it's 5 days a week. Yes?
How do you get someone that doesn't want to accept help to take that step to allow you to come in and your therapist to help them?
Juicy question. That's most of ours too. And mostly it involves setting appropriate limits. Mostly it involves, you're talking about individuals who are having a hard time caring for themselves. They don't have any money of their own. And if you continue to give them access to money and access to resources and everything else, if they continue to be comfortable living the way they're living, they're not going to go to get treatment because there's no reason for them to change. You take away the cell phone with the data plan. You give them a phone so they can make like 3 phone calls, and one of them's to you to tell me I'm ready. Take away their devices. Take away the spending money that they have. Don't give them any cash. It depends on the situation, of course, the age of the person, etc. But a lot of times it involves letting that person kind of fall to the bottom of their resource limits. And finally, a lot of times it's like, fine, I'll do whatever you say, if I can have my phone back, or if I can have my tablet back, or whatever it is. They usually will get the point. The other way is to let them fall deep enough into crisis that they don't have any choice but to go get help. And that usually involves hospitalization. So having people involuntarily committed, which in Florida, you've got the strongest involuntary commitment laws in the country. It is, as long as you've got a care provider that's willing to do it, it's pretty easy to get somebody involuntarily committed in Florida. Mandatory 72-hour hold. And then you have somebody waiting at the door that's not you, going, we're going to treatment now. You can come with me, or here's the street. And most people are afraid of letting their person become homeless. I find that most people don't stay homeless long. They're too used to having nice things. And they will turn around relatively quickly. It is a risk, but we had a client call us the other day that was family, the mom and dad were in their 70s, and they had never left the house, not since he was a teenager when their son started having a condition that they had to stick around and manage. This couple had not left their house together in all that time. And they were like, what do we do? I'm like, you need to kick him out of the house. He's 52 years old. And it's something that people don't like to hear. You've got lots of enmeshment and family dynamics and all those other things. So kind of getting into it, but setting limits, that's where it starts.
What I didn't see is the self-harm bit,
What?
because that reminds me of the story, where
I'm sorry, Stacy, what was that?
self-harm, where their condition leads them to hurt themselves. So a person like that, you really can't leave.
Well, technically, that person now qualifies for involuntary commitment because they are hurting themselves. And that's where you have to go. The hospital is a conduit. It's a medium by which you can get other care coordinated. It is not the care itself. Unfortunately, it's just not. They don't have the time, they don't have the capacity. They really don't. So getting that person to a hospital, they're awful, I know. Getting that person to a hospital and having a plan where they're going to go afterwards, not back home, that's the key. All right, we've got a place for you to go because it's clear you need help. Look at your arms. Anything else? Laura?
So I'll just say the hard part when you're serving as a fiduciary and you've got this bucket of money and you've got somebody and you're saying to them, I'm not going to give you money. Not only that, but I'm going to take everything away from you. Juggling that with your, fiduciary duty, health, education, maintenance, and support, it gets really dicey. And so one of the things that I have found through working with Todd is when you have a beneficiary with mental health issues, you have to draft around that. You have to make sure that you draft provisions that authorize the trustee to seek the advice of a therapeutic consultant or other mental health professional and to follow that advice and be absolved from liability for following that advice. Because it's the only way you can really get them help.
And I think that people avoid serving individuals who are suffering from conditions because what do, right? They're just going to burn through money. And I have, in fact, this was at the Attorney Trust Officer Conference. Laura had me come and speak at before, but a woman came up to me and she said, well, I've got he's 62 years old and he's got like $100,000 and his house. And $100,000 is in a trust. He's got unrestricted access to his funds. He just keeps inviting prostitutes and homeless people into his home and selling drugs, and he's been arrested multiple times and everything else. But we've got this $100,000. Should we try to, do something really dramatic so that we can get him help? And I said, for a person suffering from that level of condition and their age as well, it is going to be very difficult for you to effectively treat him with that amount of money for the amount of time he probably has left to live. I don't like giving up on people, but I'm also a realist. It's like, I don't know that you doing a lot to try and send this person to treatment is going to be enough, because he's got a house and he can always go back to it. He's not under guardianship. It's going to be very difficult for you to keep him out of that situation, especially if he knows that he can go back there, sell drugs and run a ring and get money even not out of his trust. It's very difficult, and he doesn't want the help. And I say, I don't know if there's anything we can do to help this individual. And I don't know if there's anything you can do either. This condition has a trajectory, and left untreated, it has a trajectory that gets more and more difficult to treat, more complicated, and harder to dig out of the trench that it gets itself into. And if you don't, the earlier you intervene, the better success you're going to have. The longer you keep them in the care they need, the better chance they're going to have to be independent at some level and have life satisfaction. Don't you want your child to have life satisfaction? Yes, of course I do. Well, you might have to go through there's some things between here and there, and some of it might be uncomfortable for you. And you just have to endure that discomfort. And then we just try to throw them as much education as we can. We just try to, read this article, watch this YouTube page, look at this parent who talks about the process that they had with their child. Something sticks, hopefully. Doesn't always, but we got a lot of resources. Thank you so much.